Hi people, how are you? Today with my pharmaceutical co-workers we will present our intervention called Take Control of Your Diabetes.
What is diabetes? Diabetes is a group of diseases which result in high blood sugar levels, elevated glucose.
There are three main types of diabetes. Type 1 diabetes occurs when the pancreas is no longer able to make insulin.
The type 2 diabetes occurs when the body cannot make a good use of the insulin it produces.
Gestational diabetes or GDM. It's a type of diabetes that consists of high blood glucose during pregnancy and it's associated with complications to both mother and child.
Approximately 463 million adults between 20 and 79 years old are living with diabetes. By 2045, this will rise to 700 million.
The proportion of people with type 2 diabetes is increasing in the most countries.
79% of adults with diabetes and living in low and middle income countries.
1 in 5 of the people who are above 65 years old have diabetes.
1 in 232 million people with diabetes undiagnosed.
Diabetes causes 4.2 million deaths.
Diabetes costs at least USD 760 billion in health expenditure in 2019. That's 10% of total spending on adults worldwide.
More than 1.1 million children and adolescents are living with type 1 diabetes.
More than 20 million live births. 1 in 6 live births are affected by diabetes during pregnancy.
374 million people are the increased risk of developing type 2 diabetes.
In Chile, this epidemic has become a critical public health situation with a prevalence of the 10% of the population with diabetes. This means that today 1 out of every 10 Chileans can suffer from this disease.
Diabetes complications. Cardiovascular disease affects the heart and blood and may cause fatal complications such as coronary artery disease, leading to heart attack and stroke. Cardiovascular diseases are the most common cause of death in people with diabetes.
Kidney diseases, diabetic nephropathy, caused by danger to small blood vessels in the kidneys, leading to the kidneys becoming less efficient or to fail altogether.
Nerve-site, diabetic neuropathy. Diabetes can cause damage to the nerves throughout the body when blood glucose and blood pressure are too high. This can lead to problems with digestion, erectile dysfunction, and many other functions. Among the most commonly affected areas are the extremities, in particular the feet.
Eye disease, diabetic retinopathy. Most people with diabetes will develop some form of eye disease, causing reduced vision or blindness.
Pregnancy complications. High blood glucose during pregnancy can lead to the fetus putting on excess weight. This can lead to problems in delivery, trauma to the child and mother, and a sudden drop in blood glucose for the child after birth.
Oral complications. People with diabetes have an increased risk of inflammation of the gums, periodontitis. If blood glucose isn't properly managed. Periodontitis is a major cause of tooth loss and is associated with an increased risk of cardiovascular diseases.
Recommendation for target group. You shouldn't eat food high in sugar.
You must perform exercises that your doctor recommends to maintain your health.
If you suffer diabetes insulin dependent, you have to inject the insulin prescribed by your doctor.
You mustn't drink alcohol in excess. This can worsen eye disease in diabetics.
If you suffer from diabetes, you should visit your suppliers every 3 months. In the visit, your suppliers can
As do you for your sugar level in blood. If you monitoring your sugar level in house, you must always carry with your glucometer.
Monitoring your blood pressure.
Verify your feed sensitivity.
examine your skin and bones of legs and feet.
Examine the back side of your eyes.
Your supplier can also send you to the laboratory for blood and urine tests. These tests can verify if your kidneys are functioning well every year.
Also, the test can verify that your cholesterol and triglyceride levels are healthy every year.
Your supplier can examine your AC1 levels to verify if your blood sugar levels is healthy.
Nicotine increases blood sugar levels and makes them harder to manage. Then they shouldn't smoke.